Good afternoon. I'm Ken Rice. I'm Dorothy and Jim's oldest son, and that was Rebecca Stern of Temple Beth El in Berkeley, who happens to be my mom's grandniece, starting us off in a really nice way. First, a few logistical issues. Bathrooms are out this door down the hallway. Please turn off your cell phones if you haven't done that yet. It sounds like that's a good idea. For speakers, we have some tissues right here. And there'll be a reception with food and drink right outside in the lobby area after the service is over. And thank you so much for coming, first of all. My mom had a long and wonderful life, and we're going to celebrate it today, and I'm so glad you're here to be part of the celebration. As you'll hear today, my mom lived a wonderful, productive, impactful, and happy life with many, many accomplishments. But I want to briefly discuss the last chapter of her life. My hope for her for the last few years was that she lived independently with her mind intact. And that was my hope for her because that was her hope for herself. She was a proud and independent woman. I'm so sorry she fell that evening at Piedmont Gardens about 6.5 weeks ago, broke her hip, and was gone 4 days later. It's not a great argument that someone died too early at age 94, but my mother really had some more life left in her. I knew her whole life, I knew her my whole life, obviously, and I miss her. However, as each day passes, I find myself more grateful that she left on her own terms, living independently and sharp until the end. That is no small accomplishment at age 94, and she succeeded in that regard. Even though she is gone, there's much to celebrate and learn from her life, which I'm sure we'll do this afternoon. You're going to hear from several of her professional colleagues. I think most of you, all you have at the program, and also several family members. And we're going to start with my brother, Tom Rice.
Hi, everyone. I'm really gratified to see so many of you here and to see some of you again. It's been a while. What we're going to do, Wendy, Max, and I are going to provide a very brief biography of my mother's life. I'm going to be covering the first 60 years in about 6 minutes until 1982 when she came to the Bay Area and to UCSF. And Wendy will take it from there. But I want to start the story even earlier with her father, Gershon, who arrived in New York City at the age of 16 from Poland. He was 16, he was penniless, and found work in a garment factory where we're told he also slept. But he was able to save enough money fairly quickly to bring his bride-to-be, Lena, to join him in the U.S. They were from a farming village in eastern Poland. There really were no opportunities for them at the time, so he and his siblings, most of them tried to leave. Gershon was the only one in the family who made it out of, made it to the United States. Three of them went to South America, one sibling went to Canada, and the rest remained and ultimately didn't survive the Holocaust. As many of you know, there are 4 children. The oldest was my late Uncle Joe, then my mother Dorothy, then 2 younger sisters, Shirley and Rochelle, and you'll be hearing from Rochelle a little bit later. Joe once described their upbringing as being dire poverty, and in fact, my grandfather was out of work most of the Depression, so one can imagine what the lifestyle was like in New York at that time. I don't think either of them finished high school, but they believed in education, and they made sure that all 4 of their kids made it through college, and some of them through graduate school as well. Now, my mother was, not surprisingly, a precocious student. She skipped a couple grades, and she graduated from high school at the age of 15, and she went on living at home to go to Brooklyn College. And she was there for a year or 2, I'm not sure which. It might have been a year and a half. But her brother Joe wanted her out of Brooklyn. She was 17. He was scared she's getting married way too young, get stuck there, and he said, "You've got to get out of there. You've got to go to the University of Wisconsin." Joe was there. He had a $2,000 scholarship. He says more than enough money for the 2 of them to live on, and so she, it sounds like a lot back in those days, and so she upped and went to Wisconsin, and she got a degree there in economics, undergraduate degree, and she even had a class with the famous Milton Friedman. So after graduation, she said she always wanted to work for the federal government. She was 19, but she had always wanted to work for the federal government. So she went to Washington and she worked for the federal government on the war effort. And that's how she met my father. It's a good story that family know about. They were working together in a converted ice skating rink. It had been turned into offices for whatever they were doing for the war effort. And my mother was good with the adding machine, another big surprise. And he, poor man, needed a big stack of numbers added up, and he asked her to help. And she helped, and she gave him the answer, and he asked her what he could do for her in return. And she said, and this apparently is a direct quote, "Well, I would like to have a date with your boss." So as you can imagine, this is one of the few things my mother failed in because my father was not able or willing to arrange that. He arranged one for the most reasonable substitute he could think of. And my one econ joke. A year later, they were married. And Rochelle's going to tell you a little bit about that. They were married for 62 years until my father died in 2005. So I'd be remiss in not telling you something about my father. He was incredibly supportive of my mother's career, except for occasionally pleading that she not work so damn hard. A lesser man wouldn't have coped with the rise of her career, and she couldn't have accomplished what she accomplished without his incredible support. Barbara Cooper, who you'll see in just a moment, used the word, and talked to me once, of revolutionary to describe him. And I think that that's right. I asked my mother about it, and she said, the amazing thing about my father is that he had no ego. And you know, when we reflect about it, it actually was true. It was very remarkable. So just briefly, many of you already know about her career, but let me just talk about it very briefly. She had a series of increasingly responsible jobs for the federal government after she arrived in Washington. And the most notable was the last one for the U.S. Public Health Service, where in 1949, she published estimates of the need for hospital beds in every region, every state. It's this book, I have the book, and it's just all numbers. I don't know, in the pre-internet day, how she could have ever found all these numbers. this was basically part of the government's efforts to increase rural hospital beds as part of the Hill-Burton Act. So she published this, did this research, published this, but she was already age 27, and it was time to have babies. So at age 27, she had her first baby, Ken, then Don, then me, and she's home for 11 years. And you know Mom, so you imagine how busy she was. So she worked for the League of Women Voters, volunteer work in the Cub Scouts and the PTA and all those sorts of things, and stopped until I was in first grade. And then my father encouraged her to go back to work. Because he said, "Isn't it time you got paid for everything that you're doing?" And she replied, and I quote, "Who would want to hire me?" Anyway, someone hired her, and she accepted a position in the Social Security Administration. She eventually became Deputy Assistant Commissioner for Health Statistics. Just in 3 bullet points about her accomplishments. The first accomplishment has to do with health data systems. So this is something obviously she continued at the National Center for Health Statistics, but she was involved in putting together with others, including Barbara Cooper, what we now know as our National Health Data System, particularly in the area of health expenditures. And she was looking also at the pre-critical period of before Medicare and Medicaid passed. So I think that one theme of what she did early on was trying to put together a better health data system for the United States, something that I certainly have benefited from and many of you have in our careers. Second was that she reported on the dire state of health insurance among seniors in the United States. She did a study that found that half of seniors did not have any health insurance coverage, and many of the rest had very poor health insurance coverage. So yesterday, Karen Davis, who's very sorry she can't be here, wrote a blog for Health Affairs. So I urge you to take a look at it. And the first link in the blog, I believe, is her 1964 Social Security Social Security Bulletin report about the state of health insurance among seniors in the early 1960s. The third area, and the area that she became most known for from a methodological standpoint, was developing methodology and also getting the data to estimate the cost of individual diseases and the cost of illness in general, work she did with her, at the time, very young colleague, Barbara Cooper. Finding the data was a challenge. The methodology was original. Other people had estimated cost of illness, but what they were able to do was also estimate indirect costs, which is the cost of lost productivity, people's lost time. And one thing that they did that no one else did is develop very innovative ways to value the time of people not in the labor force, which is particularly housewives. So she continued to do this work, as Wendy will tell you, when she came to UCSF. And she once said, and I quote again, "You name a disease, I did a study on it." So anyway, in 1976, she got the opportunity of a lifetime to run a federal agency, the National Center for Health Statistics. And there's something I know about that no one else knows, because I was there one summer home from college during the application process. So she was sitting at her desk in her small bedroom. This is before we invented home offices, so she was there working away, as she always did in the evening. And she said in the application that there are 8 criteria, 8 experiences they're looking for people to have, and she actually had 7 of them. The only one she did not have was state health policy. So she didn't think to get the job, but when I heard she had 7 of the 8, who else could have had that? And so it's not surprising at all that she got the position at NCHS. And by all accounts, she was an absolutely legendary leader there. She developed new surveys, and she produced key publications about the U.S. healthcare system, and really turned the publication Health U.S., which I believe started the year before, into what we know and what we relied on all these years. She said her greatest accomplishment was pushing for and starting the National Death Index. And what the National Death Index is what it sounds like, but what it allowed researchers to do is to take detailed survey information where you could find out all about people's lifestyles, et cetera, and merge it with ultimately if they died or not. And that gave researchers an opportunity to better understand the determinants of mortality. So anyway, That's what she said she was most proud of at NCHS. But after 5 years there, Reagan got elected president, and there were substantial cuts to her agency, cuts in the frequency of her surveys, the sample sizes of her surveys, and the staff. And she didn't want to take it any longer. And in addition to that, my father wanted to retire. He wanted to move to California. He'd reached 62. He had 30 years in the federal government. So that's when they moved to Berkeley in 1982. And as many of you know, 9 years later, they lost their house in the Oakland-Berkeley fire. But they were remarkable about the whole thing. I think they would have taken it better than 95% of the population. My mother was upbeat, and my father didn't care about stuff. And so it really was very impressive how they were able to rebound from that. So that's my part of the story, and I'm going to let Wendy pick up the rest of the story about her career. Many of her colleagues, you'll see today, will be talking about her legacy, including as a mentor extraordinaire. I didn't really mention that. I'll let others talk about what my mother was like as a mentor. And we'll also have family members talk about how great of a mother, sister, grandmother, and aunt she was. Wendy?
Thank you, Tom. It's a delight to see so many people here today. If I close this, does something happen? Okay. So let me pick up the story where Tom left off. As Dorothy told it to me, one of the reasons they wanted to move to the Bay Area was because 2 of their 3 sons happened to be living there at the time. So she waited until the next time Phil Lee, her good friend and colleague who had since come back to UCSF, when Phil Lee was in town, she invited him for dinner and asked to discuss with him possibilities for coming to UCSF. Well, Phil put her in touch with Carol Estes, and the rest is history. Carol arranged for her to come to UCSF as a Regents lecturer in the Institute for Health and Aging. And so at a time in their lives when most people are looking to kind of slow down and relax and take it easy, Dorothy embarked on a new 30-year career as an academic researcher. And by the way, somewhere between the East Coast and the West Coast, Dorothy morphed from Dot to Dorothy. I'm always amused. I think the family all call her Dot, but we knew her and we loved her as Dorothy, but same person. So when Dorothy came to UCSF, she continued the work she had been doing on the cost of illness and the health of the population, and she just loved being able to do research. I remember her telling me at one point what a luxury it was to come into the office and to be able to work on whatever she wanted, as opposed to when she was the director at NCHS, and she would come in and someone would hand her a list of a full day of meetings at 30-minute increments with no time to do anything of her own. But there were still some holdovers for Dorothy from her days in Washington. I mean, we all know that she always looked like $1 million. Her hair was perfect, her clothes were elegant, and she once told me that, during her days in Washington, you never knew when a reporter from the 6 o'clock news was going to show up to interview you. So Dorothy was always ready. She always dressed with the assumption that she was probably going to be on the news that night. So I'll never forget the day, not too long after she arrived. I had met her through some other studies I had worked on, and she gave me a call, and she said, she'd just gotten this grant to do a report to Congress on the cost of injuries, and she was going to be working with a health economist who had taken a job and up and moved to New Jersey. Would I be interested in working with her? And so we talked a bit, and I said, it sounds really interesting. Can I sleep on it and let you know tomorrow? No, I need to know right now, and you would be perfect. I mean, this was typical of Dorothy, sort of believing in people that I wasn't really sure why she had any faith in me. But I took a deep breath and I said, okay. And, my life was never the same. To paraphrase Rick from Casablanca, that was the beginning of a beautiful friendship. I had the privilege of working with Dorothy on various studies over the next 30 years. We looked at the cost of injuries, we looked at disability, Alzheimer's disease, the motorcycle helmet law, intimate partner violence, among others. And in addition, she conducted the first study, actually a series of studies, on HIV/AIDS in the very early days of the epidemic, along with Ann Skotowski. She studied costs associated with mental illness, chronic illness, and as Tom said, just about any disease or condition that you can think of. And she continued her passion for studies of care for the aged and the implications of changing population demographics on healthcare needs. Now, Dorothy had a real talent for telling the story, for gleaning the real message that were behind the numbers. She knew how to present statistical findings in a way that policymakers and others would really be able to see what was important here. The analysis was important, but so was the presentation. And I think that's a lesson that many of us learned working with her. And in this way, she was able to have a tremendous policy impact. And I remember her telling me at one point that she was really delighted not to be in the government anymore, because now she could criticize what was going on in Washington and, have a real opinion. She could express her opinion on what was happening. And she took great pride in that. Now, one particular passion for Dorothy was the cost of smoking. And she got me and a number of others hooked in doing research in this area. Shortly after she came to UCSF, she published a study on the cost of smoking, which became the basis for a software package that the CDC put together and that the CDC distributed to states who wanted to estimate their state-level costs. And that program has been revised, and it's still used today. I worked with her on a number of studies looking at the cost of smoking in California, and a number of us also worked on national level tobacco control issues. We estimated costs for every state in the country. We looked at cost to Medicare and to Medicaid. And in fact, in the mid-1990s, when the attorneys general were suing the tobacco industry to recoup Medicaid costs that they were forced to bear, Dorothy and a couple of others of us, Len Miller, some other colleagues, got involved working with the attorneys to estimate what the attorneys call the damages. But these were the costs that the industry needed to reimburse the states, because it was the industry's doing that had led to the state incurring these costs. We had the state-of-the-art models, and so these attorneys sought us out. And those were very interesting times. The work resulted in the largest public health settlement ever, $206 billion over the course of 25 years. As a result of Dorothy's expertise and passion for tobacco control, she was appointed to the State Tobacco Education and Research Oversight Committee, TROC. I see a couple of TROC folks here today. This is the committee that oversees the California tobacco tax revenues. And Dorothy, I think, was the longest serving member on that committee. She was continually reappointed for, it was at least 15 years. They loved her, and she loved being part of that work. And we all loved her at UCSF as well. She got many honors over the years, and I won't go through all of them. I think they're in the program. But I do want to mention one in particular, which was the UCSF medal that Dorothy got in 2002. This is the highest honor that UCSF gives out. We don't give out honorary degrees here. We give out the UCSF medal. And it was a wonderful and fitting tribute to this amazing woman. Now, Dorothy did important, insightful work, but I think her greatest legacy really was in training the next generation and the generation after that to carry on the work. As Tom said, and I can personally attest to, she was an amazing mentor. Whenever I hear discussions about how important it is to find a good mentor and how we need to make sure all of our junior faculty are paired up with good mentors, I always feel kind of smug, because Dorothy was my mentor. I had the best mentor, period. So it just, she wrote the book on how to be a great mentor. She loved to impart her wisdom to younger people. She would come to my health economics class every year and give a talk on Medicare. And she would tell her personal stories, because she was there when it went into effect, and how important it was that now virtually all older Americans have health insurance. Her passion would come through, and the students would, every single year, they would always tell me that that was their favorite and their most inspiring class of the quarter. Until one year she told me, I don't think I really need another line on my CV. Maybe you could give that lecture. And I thought I could never give that lecture, but they just loved it. I mean, Dorothy was selfless in how she would help people to make connections. She believed in people, often more than they believed in themselves. And her warmth and enthusiasm were contagious. I worked with her on a number of studies where there would be a whole group of people, and everybody always got along. It was uncanny. Dorothy just set the tone. We all loved working with her so much that we ended up loving working with each other. It was really something that she passed around. In 2000, we established the Dorothy Pechman Rice Center for Health Economics at the Institute for Health and Aging. And this was to honor Dorothy's remarkable career, her legacy of careful and thoughtful analysis of economic and health-related policy issues, and also her long legacy of mentoring and conducting research. The Rice Center sponsors students and postdocs. We also offer symposia on topics of interest, and this work is going to continue. We held our 6th Dorothy Rice Symposium about 2 months ago. I think it was the end of January. Dorothy sat right there in the front row. The topic was housing and economic security among older Americans. Before the event, I said to Dorothy, would you like to come up and say a few words at the end of the symposium? And she thought about it, and she said, well, I guess I could thank people for coming. So sure enough, at the end of the symposium, I invited her to come up, and then she proceeded to speak for a good 5 minutes, offering her cogent insights on the importance of housing and community and engagement, and talking about how wonderful her experience was living in Piedmont Gardens. And then she thanked people for coming. It was typical Dorothy. She always had something on the mark, important, insightful to say on just about any topic you could think of. I've learned so much from Dorothy, from her advice, from her suggestions, but mostly from observing how she operated in the world. She's opened doors for me and then kind of gently nudged me through them. She's helped me with everything from how to conduct research, how to present findings in a way that they'll have the maximum impact, to how to raise 3 sons. I keep now finding myself thinking, oh, I'll have to remember to ask Dorothy about that, or, oh, Dorothy would love that, I'll have to tell her that. I miss her dearly, and I credit her with much of who I am today, and I know that many others feel the same way. There will only ever be one Dorothy Rice. Thank you.
Thanks, Tom and Wendy. If I can add a little addendum to the Dorothy Rice symposium here a couple months ago, and Wendy said she came up here and wasn't going to say much, and then she spoke for her 5 minutes or so. What was amazing, and somehow, and it was a very, very interesting and good panel that went on for an hour plus, I think. And in the 5 minutes, she kind of stole the show. And and the reception afterward, a number of people came up and said, "Oh my God, your mother once again just, effortlessly took the ball away and ran with it, and just was absolutely beautiful." And the other thing is, this woman she used a walker the last year or two of her life, and she came up, and Tom helped her up to the front, and she got in front of the mic here, and all of a sudden, she was 20 years younger. It was this magic that she had in certain situations. It was just always remarkable to see. Next part of the program says Remembrances of an Amazing Woman. So we have about 15 speakers, about a third of whom are family members. The rest, I believe, are professional colleagues. Some I know and don't know. And one, Barbara Cooper, the second speaker, I think I last saw 45 years ago until we chatted out in the reception area before the service started. So my mom's younger sister, Rochelle Novins, will speak first. And Rochelle was part of my mom's upbringing way back when in Brooklyn, and she'll tell us all about it. Oh, and also, for subsequent speakers, I don't have to introduce you. If you have a program, once the previous person is done, just mosey on up here and start your talk.
Can you begin to imagine how lucky I've been to have Dorothy Rice as my sister? And as Wendy said, at home, among the family, we called her Dot. Dot was 14 years older than me. So at times she was like my mother, my mentor, always my idol, and as we got older, we were best friends. I need to tell you about our very humble beginnings and how our 4 siblings grew up, the children of immigrants. My brother Joe was born in 1918. After Joe, my parents had 3 daughters, Dorothy, Shirley, and me. My sister Shirley is so very sorry that she's unable to be here today, but she helped me in composing these remarks about our cherished sister. Let me begin with the apartment that we grew up in. There were 4 rooms. You walked into a small entry. To the left was a bathroom, the kitchen, and 2 small bedrooms off the living room. Mama and Papa had 1 bedroom. Shirley and Dot shared a bed in the other bedroom. Joe slept on a cot that was opened every night in the living room. The cot became mine after Joe went to Wisconsin and I was too big for the crib. The bathroom had a tub, but no shower and no sink. We simply bent over the tub to wash our hands. The toilet had a tank with a pull chain. We grew up in poverty, but we never felt poor. Only when we got older did we realize that. Coming home from school on a Friday afternoon, you could smell my mother's chicken soup before you got through the door. The apartment sparkled. That Orthodox Jewish home was rich with strong moral and ethical values. We all had a Hebrew education and went to services every Saturday morning. Our social life centered around the relatives, friends, the synagogue, and the Jewish holidays. But most important was our education, and our parents always encouraged us to go on, convinced that diligence and hard work would in the end be rewarded. My most vivid recollection of Dot was during the war in 1943. Dot and Jim were to be married in our apartment in Brooklyn. Jim was going to come north on furlough from Atlanta, and Dot was on her way home from Washington when we got the call that Jim's furlough had been canceled. She had been riding on the bus and saw her wedding cake in the window of the bakery. She walked into the apartment, all excited, full of joy on seeing the wedding cake, and we had to tell her that Jim's furlough was canceled. My parents surprised us by allowing Dot to travel to Georgia with the promise that a rabbi would marry them. The only available rabbi was Orthodox with a long white beard, and he told Jim to bring 10 men because you needed to have a minyan of 10 men to conduct a religious service. Somehow, the rabbi's wife found out that 2 of the men weren't Jewish. Had to be 10 Jewish men. At the last minute, she scrambled and found 2 more Jewish men, and the wedding ceremony was finally allowed to proceed. My big sister Dot told me, don't fuss, don't complain, make up your mind and do it. Dot taught me how to make brownies, chocolate chip cookies, and keep a budget book. Then she taught me, when you have a dinner party, you must do it the Washington way and never sit husband and wife together. Always efficient, Dot also taught me shortcuts to great cooking. Chicken a la king, can of Campbell's mushroom soup, can of water, some cooked chicken, pour over cooked rice. So what do sisters talk about after 60-some-odd years of Sunday night phone calls? Some world events. Dot was a TV news junkie, and she taught me that too. But mainly we talked about our amazing, brilliant, and you may not believe this, but sometimes frustrating kids, their spouses, and later our awesome grandkids. Also, we talked about how much we love the fact that our kids, the cousins, have become good friends. Sisters also talk about hair. As a child, Dot was the only one who had gorgeous, thick, blonde curls. So, of course, she spent most of her young adult life straightening her hair. I kept trying to convince her to let the curls be. Finally, she listened to me. She let her hair grow gray when she was 60 and said it lifted a great burden. Of course, I followed her lead. What a relief. But she wasn't just our Dot. She left far more than a dot in the world. Dorothy Pechman Rice left an important mark in the history of American healthcare, and I am especially proud that she will be an example to women of future generations. Dot, I miss you so.
"53 years ago, Dorothy walked into the health economics branch of the Public Health Service, and she changed my life forever. I had just been hired a few months before, fresh out of college, and was assigned as her research assistant. Poor Dorothy. I had never studied economics. The only thing I knew about healthcare was maybe how to order birth control pills. And I certainly knew nothing about research. But if Dorothy was disappointed, she never let on. That was not her way. She never lost her cool. She never cursed. She only acted like a lady. So she just put down her white gloves and proceeded to teach me. She was my mentor, but much more than that, she was my office mother. One time I told her that the boy I loved, I thought that weekend might propose. Suddenly I got a call at home, and she never called on weekends. "I'm calling because I have a question about table 23B. Did he ask?" Yes. When I was pregnant, and ready to leave the workforce and live happily ever after behind the proverbial white picket fence, Dorothy would not let me resign. You don't have to make up your mind yet. Just wait. Then 6 months later, I get this call. The House Ways and Means Committee needs a study on the cost of accidents, and I have no one else who can do it. Just come in 2 days a week for 2 weeks, and I know you can knock it off. Please do me this favor. So I did. Next thing, why don't you make this permanent? Just 2 days a week. And that was the end of the white picket fence. She fought to establish a part-time position for me, and then for women who followed. In the early 1970s, this was really quite revolutionary. Women's issues also surfaced in her groundbreaking work on the cost of illness, as you heard. She was the first to estimate the cost of all diseases by type of disease, and the first to place an economic value on homemaker services. And most women at the time, adult women, were homemakers. But she did not want them to have a value of 0. So she used the salary of a domestic worker. This did not go over well with women's organizations. The next time around, she had found a better way, and this time the study was even reported favorably in Good Housekeeping magazine, so it must have been okay. Dorothy also was the moving force, as Tom said, behind national health expenditure accounts. She worked on the earliest reports on what it costs the nation each year for health care. And then she continued to develop and improve them and counsel those who followed to work on them. The health spending numbers have found their way into nearly every health economics study in the last half century, and they continue to do so today. Maybe even the cost of replacing Obamacare, for example. We worked together on these and other studies for over a decade, and it was always exciting to come to work. This fun-loving, warm, feisty woman was definitely not the green eye shade type of economist. I still remember her arguing with the manager of the Chicago Playboy Club that I was over 21 and could come in. I cannot imagine how dull my life would have been without her in it. She was amazing. She could sew a dress. She, for a while, made her own clothes, throw a dinner party, run her home for Jim and the 3 boys, and come to work and do pioneering research. Dorothy was a giant in her field and a giant human being. And her legacy lives on in the many researchers she mentored and influenced, and those have gone on to train others, and so it goes. She will certainly be missed.
Hello, I'm Don. For those of you who don't know me, I'm the middle son, and so I'm all screwed up. Now, you're going to find out how screwed up right now. I'm going to talk about genetics. No one else here, I think, is going to talk about genetics. In particular, I'm going to talk about the little-known statistics gene. Yes, there is a gene for statistics. In our family, it started with my Uncle Joe, who was ultimately director of economic studies at Brookings. And then my mother got the statistics gene. To my generation, she didn't pass it down to Ken. Ken, it was latent, or I don't know, it just wasn't there. It was very, very recessive. She passed it down to Tom majorly. I mean, Mr. Health Economics Dr. Health Economics. With me, the statistics gene mutated. Now, I'll tell you how I knew what was mutated. I was in high school. What was my favorite book in high school? How to Lie with the Statistics. Great book. We used to say she was into statistics, I was into heuristics. And that was just about the way we did it. She would say, I would say, correlation does not imply causation. And she'd say, yes, it does. I'd tell her, Ma, shorten that chart scale so that people can see the differences in the data. No, it would be misleading. Finally, we agreed to disagree. I went my way, she went her way. That was just the way it was. But you know, there was nothing on earth that my mother couldn't cost out. And unlike the lazy academics here, I pulled them all out. In all alphabetical order, it's only 24 that I found the cost of. Aging, AIDS, alcoholism, Alzheimer's, anxiety, breast cancer, cancer, chronic conditions, depression, disabilities, domestic violence, drug abuse, gender-specific cancers, head injuries, illness, injuries in general, instant access to health care, long-term care, mental illness, musculoskeletal conditions. I didn't know about that one. Osteoporosis, schizophrenia, smoking, and last but certainly not least, upper extremity disorders. I don't know where she got that. So really, that's about it. She was way ahead of her time. She was around so long ago and for so long that there wasn't even a thing called a glass ceiling. So she didn't have to break it. It didn't exist at her time. As people have said, she was a mentor, and a mentor particularly to other women. She had a very long, full life. Let me tell you how long. I asked her a question. I said, Ma, what's it like to have 2 kids on Medicare? So you know, she did. I mean, and Tom is not far away, believe me. So she had all her marbles right to the very end. She would have loved to be here with you all today, and I hope you learned a whole lot about genetics, and thank you so much for coming.
Hi, everyone. I'm Cliff Goss, and we're here to celebrate the life of a dear friend and family member. Dorothy was to me many things. I'm humbled to stand before you and tell my story of what Dorothy meant to me. While I can't claim a biological family relationship, in a minute I'll tell you why, in Dorothy's words, she would have said, Cliff, that's just a rounding error. How many times did you say that, Barbara? So anyway, I met Dorothy when I first was employed at HEW, my first job, and in the assistant secretary's office. Dorothy was in Social Security, leading the economic analysis of Medicare and the health cost studies with Barbara. She was branch chief, but soon moved up to deputy director of the Office of Research and Statistics, and had the job of finding a replacement for her former boss, Howard West, who was the division director. She pulled my arm too, and her bet on me for that job changed my life and set the course for the rest of my career. As I look back on that decision. I guess I'm so humbled that she and Howard could see me as their successor and a protector of their legacy. Our bond before this time and after, for as long as we knew each other, was sort of one general thing, and it was to seek truth from data and to do it timely and transparently. And I think that's what Dorothy's life was about. She mentored me on many other principles and projects over the years, first as her employee, then as her partner in some of the most consequential events in healthcare during the 70s and 80s. From respecting the welfare of Medicare beneficiaries to the protection of our national health statistics enterprise, she led and I followed. In addition to being the creator of the National Health Expenditure Accounts with Barbara, Dorothy was responsible for how Medicare data would be structured for this country, how it would be collected, and how it would be translated into information that to this day we still use. She and Howard also saw to it that things like diagnoses on the claims forms would be coded and archived to the Medicare data system. In those days, it was just handwriting, doctor's handwriting sometimes. What we accept today as a routine process, or in those days manual, I'll never forget the early weeks of my new job when she said, hey, let's go see the nosology department. And I looked at her in total dismay. Nosology? Even my spell check today couldn't find that word. However, there were over 300 employees grinding out everyday diagnostic codes on hospital claims as they flowed into the Medicare system and putting numbers into the database. So she was so fundamental back in those days to creating what has been the foundation now that we live on in those of us in research and policy. The other remembrance was when we wanted to do a statistical run of the Medicare data, all those codes were stored in these huge round tapes on racks and racks, as long as this room. And we'd have to load those, the staff would load those tapes onto these computers, and when Dorothy would say, we want to know this about the Medicare population and so, we'd work the weekends to literally turn those tapes and grind out the tables that everybody then used in their policy work as well as published. Dorothy also pioneered building economic models to predict health expenditures under varying policy scenarios, like changes in health benefits, like who gets covered under health insurance. And imagine 43 years ago, trying to convince the research and policy community that we could estimate those costs by changing a piece of legislation. Anyway, I had the privilege of shepherding this in-house Social Security National Health Economics model that Dorothy really led the creation of, and ultimately it was moved to the National Center for Health Statistics. But the recent CBO cost estimates from their model that doomed repeal and replace legislation, that economic model has some of Dorothy's DNA in it. And I am sure she is just smiling about that. So finally, I want to tell you a story about why I view her as family. In 2003, I made a somewhat routine trip to see her and Jim and to catch up on our lives. I learned that she had recently undergone bypass surgery, and we proceeded to discuss sort of what had been her symptoms. And she said some mild pain in my arm and incredible fatigue. For the 3 previous weeks, I had experienced the exact same symptoms. In her firm and loving way, she said, Cliff, you need to get to see your doctor now. So I changed my plans to fly back to Los Angeles, where I was living, and I flew to DC to see my cardiologist the next morning. After 5 minutes with an EKG, I was off to the hospital. Turns out my coronary artery was blocked by 90%, the widowmaker. And so our colleague, your mom and grandma, had saved my life. And today I thank Dorothy again for all the inspiration and a lifetime career and for my life. Thank you.
My name's Morgan. I am the oldest of 4 grandchildren. This is called my amazing grandma Dot because I guess, at least among family members, she was always Dot. Having moved to the East Bay the year before I was born, my dad's mom, my grandma Dot, was a regular presence in my life growing up. I knew a handful of facts about her professional accomplishments. I knew that she was a health economist. I knew that she used to work for the federal government, that she now worked for UCSF, and that she continued to attend conferences in Washington. I also knew that colleagues thought so highly of her that they did things like give her awards, a doctorate, and apparently 6 symposiums in her name. My parents, as my Uncle Don alluded to, were not health economists. My dad did not get the statistics gene. As far as I knew, neither my mom nor my dad had ever worked for the federal government, had ever been on the faculty of a university, attended a conference in Washington, or been the namesake of a symposium, much less 6 symposium. On the contrary, they were artists. My dad was a photographer, my dad is a photographer, and my mom was an illustrator and writer. They achieved in ways that were usually harder to quantify. They were, and my dad still is, courageous, creative, flexible, realistic, and only eventually and reluctantly, and I think never in the case of my mom, registered Democrats. And so I saw a dichotomy between health economists and artists. And I assumed that I would grow up to be the latter. In at least 2 ways, and probably many more, I was wrong. I was wrong about my own professional and political trajectory. I didn't grow up to be an artist, but an attorney, a career path that no one was perhaps as proud of as Dot. My party registration and fidelity have also proved more like Dot's than like my parents'. But my crude dichotomy also failed to describe Dot. While she never stopped accruing professional accolades, in the last decade, what amazed me the most about Dot were all these other marks of character. After my grandpa Jim died, Dot spoke openly and candidly about being unhappy remaining in their house. She then made the courageous and astute decision to give up her 3-bedroom house to move into an apartment at Piedmont Gardens, where she resided until this February. It wasn't until after Dot died that I learned she'd willed her body to this institution. 6 weeks later, I'm still in awe of her incredible progressiveness. Perhaps it is standard for health economists to donate their bodies to science, but there's no way it's standard for those born in 1922 to do so. Last year, at my dad's suggestion, I read Atul Gawande's Being Mortal and felt my worldview shift beneath me. In the face of illness, there are decisions we can make that may or may not extend life, but will enrich it for us and for those around us. Looking back 13 years, my dad and I wonder whether we made the wrong choice with my mom when her cancer returned. And we know that we did. I don't know if Dot read Being Mortal, but if she didn't, it's because she didn't need to. She didn't need to, not because she was faculty here or because she'd studied aging. She didn't need to read Being Mortal because she already knew how to make end-of-life decisions, just as she knew how to make all other decisions in her life. It is this remarkable clarity, decisiveness, and sense of self that I aspire to follow. Thank you.
Hello, I'm Carol Estes, and I am the lucky duck, quack, quack, who was fortunate enough to recruit Dorothy Rice to UCSF. And that was possible because of Phil Lee, a longtime close partner and friend, who introduced me to Dorothy in 1981 in Washington, D.C., and told me that she was a remarkable and legendary woman. She had just retired from being director of the National Center for Health Statistics and was deciding what to do next. Phil told me that Dr. Joyce Lashoff, who was then the dean of the School of Public Health at Berkeley, was in hot pursuit of Dorothy. I was just a full professor at UCSF who had co-founded with Bob Newcomer the Aging Health Policy Center, and this was the forerunner of the Institute for Health and Aging that we now have, for which Wendy Max and Pat Fox have been co-directors, and now Wendy is director. I was also chair of the Department of Social and Behavioral Sciences in the School of Nursing. As always, Phil Lee had an idea, a fabulous idea, and a plan. Phil was the matchmaker in our successful recruitment of Dorothy as the most distinguished and acclaimed faculty member ever to cross our portal. The backstory is always about finding the money and how to make it happen. We were in the fortunate situation that Dr. Shirley Chater was then the vice chancellor of UCSF Academic Affairs, and at that time, the highest ranked woman in the UC, all campuses, all 9 campuses then, administration. And another wonderful fact was that Shirley Chater had an academic department in my department. I mean, her appointment was in the Department of Social and Behavioral Sciences in the School of Nursing, which I was chairing. However, of course, our roles were reversed as Dr. Chater was advocating the advancement of women and excellence on the campus and was mentoring me on things I could do and be as an academic leader on campus. Full circle, Phil, former UCSF chancellor, advised us both where to look for the money, where the possible funds might be to bring Dorothy here for possibly as much as 2 years. He advised that there had been and was a line in the budget, unrestricted monies in the chancellor's office for a regent's lecturer position, and he observed that it had not been filled since he had left the chancellor's office. So maybe Dr. Chater might look at the budget and see if there was anything possible there. By the time we got back from Shirley's office, the phone was ringing in mine, and Dr. Chater said, "We have the money." I walked right into Dorothy's office, and voila, lucky duck. Thus began Dorothy's 30-year career at UCSF. To say she pioneered in the development of the entire field of the economic costs of medical care, and with Ann Satofsky and Barbara Cooper and others, her credentials were perfect. Research, leadership in building and moving key data, really the originator of what we now call big data. Collaboration, knowledge, trust, effectiveness in making the case to Congress, and the invaluable ally of every director of every institute at the National Institutes of Health in making the evident information about why their particular institutes were essential and why funding for NIH was essential. It is not an exaggeration to say that Dorothy has done more to advance public understanding of health and medical costs of any other person in our history. And as we know, beginning in 1941 as a clerk in the Social Security Administration. Her astonishing bibliography, thank goodness we heard the alphabetical listing. And of course, there are many subtitles under each, just invaluable. And I had the wonderful opportunity to work with her when our Shirley Chater was the Commissioner of Social Security under the first term of President Bill Clinton. And Shirley invited me to take an IPA, an intergovernmental personnel time out from UCSF, 50% time, to work on evaluating what was the Social Security capability after the Reagan years of really dissembling the concentrated and capable efforts of Social Security Administration for evaluation and statistics, and in particular looking at the distributional effects, or having the capability to assess the distributional effects of changes in Social Security. She brought wisdom, unparalleled institutional and historical knowledge, and it was a very marvelous experience, which resulted in subsequent commissioners under the Clinton administration making major changes there. The Big Oakland fire, stunning grace under fire, literally. I remember her telling me she knew it was happening. She was going down to do babysitting for non-babies, but for children, grandchildren, and Tom and his wife were going to, I think, to Hawaii for a vacation. So she rounded up all of the pictures she could find and quietly closed the door and left and went to the airport. She is a case study in resilience. A public intellectual in the most profound sense of that word, from the highest and deepest reaches of government to all corners of the globe in academia, dedicated and relentless public education, facts and fist, resistance in the tobacco industry fights across the spectrum. It is the practice of emancipatory knowledge-making that she offered and taught us. Raise a fist, picket signs in the non-smoking rights demonstrations at the Virginia Slims tennis tournament. Dorothy was a transformative change agent, and she was the most gracious, tough boot of an old woman, a crone. And now, with the possible destruction of health insurance and very radical steps with regard to that, the ground she laid, seeding the field, teaching her mentees and all of us so much, we have the capability to roll out the statistics about the terrible effects and the other consequences of raising the age of eligibility for Medicare from age 65 to 67, and every other thing that may be thrown at the field of health insurance, health economics, and health care. Dorothy Rice was a feminist who affirmed Adrienne Rich's insight that the most important thing one woman can do for another is to illuminate and expand her sense of actual possibilities. Thank you, Dorothy.
Hi, I'm Clara. I'm one of the 4 grandchildren, one of the recipients of babysitting at age 4 while her house is burning down. I really don't think we knew that was happening. I don't think we were told. I think they just came down, babysat, as if nothing else was going on. I've also lived in Oakland for the last 6 years and are near Oakland, so I got a lot of time with Dot the last few years, which was great. So, as you all know, my dad, Tom, is in a similar industry. And one time, when my brother Danny was little, he was asked what his father did for work. And his response was something like, he works from 2 to 4 on Tuesdays and Thursdays. This could not be more inaccurate, but that's what we thought. My relationship to my grandmother had a similar disregard for her professional self, although I'm sure that it informed her role as my grandma Dot. She was the matriarch and the mentor and the grandmother to everyone around her. She was grandmother to all variety of local cousins and second cousins and nieces and grandnephews and whatever Scott said the other day, sisters, husbands, brothers, kids, it's all the same, didn't matter. I learned that she was grandmother to the next generation of females in her industry, counseling them regardless of her workload and changing lives. She was grandmother to the employees at her retirement home, Piedmont Gardens, literally picketing in the streets against unfair layoffs and raising over $150,000 the last few years for their holiday bonuses, which also changed their lives. And lastly, she was grandmother to her own personal forest of plants at her house. Even at age 94, she kept dozens of plants thriving, from orchids to a tomato plant to 2 very big trees that were in her place. My husband Emmett and I inherited a few of the plants, and I'm very nervous about keeping them going. I do not think that I am as capable as a 94-year-old in keeping these plants going strong. In fact, when we were cleaning out her apartment, we found photos from over 10 years ago of Dot posing proudly with her grandchild ficus tree. It's still alive. This is where my notes sort of devolve, but my last thought is about our wedding, which is in September. Actually, a precursor to that is just the very amusing transition of Emmett, what she called Emmett. He was my friend for a very long time. He would come to Piedmont Gardens and be introduced as Clara's friend, or as just Emmett. I think he became boyfriend, 3 years into our relationship, but fiance was fast and husband was fast. She was excited. She made those transitions better than I did. So when we told her, we had a beach day in Alameda when we told her and some other family that we got engaged, and she shrieked. Don't think we've seen her that happy ever, and she's a very happy person. Then, somewhat morbidly, she spent the next year telling us pretty constantly that our wedding was literally what she was living for, no pressure. Lastly, she gave a speech at our wedding, and I think it was maybe the one time ever that she was in a wheelchair. I think Dawn amazingly convinced her to be in a wheelchair, which was very useful. But when she came up to give her speech, she said something along the lines of, "I need to stand up, they all want to see me." She did, they did. And after the wedding, people said, "Your vows were good, your dress was nice, food was fine, but your grandmother's speech was amazing and it made me cry." That's all we heard about afterwards. And rightly so. Thank you.
I'm Hal Luft. I feel particularly honored to be here because, unlike most of the previous speakers, I'm not related to Dorothy, and I've never really worked with her on a research project. We never had a formal mentoring relationship, yet I feel that Dorothy has always been involved in my career. She was like a kindly fairy godmother watching over me over decades. I was a grad student in what was then the nascent field, which had been birthed by Dorothy and some of her colleagues, of health economics in the late 1960s. What attracted me to that field was its applicability to real-world problems and thinking about how to address those problems. And our readings included work from Dorothy on the cost of illness. Her empirically based approach helped me identify a dissertation topic. Actually, it was the third topic that I tried. And it was poverty and health, the economic causes and consequences of poor health. And I like to think that it really built on work that Dorothy had begun. Now, by the time Dorothy moved to become director at NCHS in 1976, I had moved to Stanford. And I was switching my focus from health, because that felt too hard, to healthcare. That was much more manageable. Dorothy and I would occasionally cross paths at professional meetings, because she was still in DC and I was here. And I was always interested in what she was accomplishing at NCHS, because I was a real data grubber. And the work that she was doing there was really critical. But she was always interested in how I was doing, not just what I was doing. When she left NCHS to begin her third career here at UCSF, the Institute for Health and Aging, I was already here. So I could welcome her in, but we only got together occasionally at various gatherings because she focused on the cost of illness, particularly the impact of smoking and various other things of that sort. And my focus was on medical care, i.e. when prevention fails. So there wasn't a lot of overlap in what we did. And then we'd get together at annual meetings of the Institute of Medicine in Washington, D.C., and always sort of quizzically joke, why did we have to travel 3,000 miles to get together at these meetings? But Dorothy's long-term collaboration with Wendy Max offered a wonderful, regular way to connect with her. Wendy and her husband Bob hosted an annual New Year's Day open house in Palo Alto. And it was about 1.5 miles away, and we'd often walk there, even on New Year's Day, and sit down and talk to Dorothy. Now, most of the researchers there, because there are a lot of researchers, because of both Wendy and Bob, would ask each other, what were we up to? Meaning, what kinds of research were we doing? Dorothy would ask about that, but she'd also ask about our kids and grandkids and things of that sort. And the last time I connected with Dorothy on that was this New Year's. So several takeaways. One, pursue, potentially over decades, research that informs policy to help people. Good research rests on good data. Compelling findings presented simply trumps fancy methods. And work isn't everything. Nurture family, relationships, always.
Hi, I'm Inez Ponce, and thank you to Tom for inviting me, but I actually knew Dorothy before I knew Tom Rice. So in my 20s, I was not a morning person, and I think I still am not a morning person, but Dorothy Rice had office hours really early in the morning at UCSF. And this was before internet and email, so I didn't know she would be there. I mean, I didn't know if she only worked from 2 to 4, like some of us, some professors, but I still, and I think I had gone clubbing the night before, so I was like, oh, but I had to go. So because I had heard there was an NCHS director in our midst in San Francisco, and I was working for a small nonprofit advocacy organization that was challenging the ways that the National Health Interview Survey was collecting some data on the group that I was interested in, which is on Asian Americans and Pacific Islanders. So I got in time, and sure enough, she was already there, and busy. She probably wrote a paper already, first thing. But I presented my case, and she listened. She kind of rephrased more eloquently what I needed to do, so she got it. She made me feel my data cause, and at that time, this is 1989, and Secretary Heckler's Black and Minority Health Report had gone out a few years before that showed that there were disparities, minority disparities, but in terms of Asians, that there really weren't any disparities, and a lot of that was because of the aggregation. So she made me feel like what I wanted to do mattered. She gave me advice, and in her elegant, measured, straightforward way, I don't work for the federal government anymore, but I know how they work. And she said, you brought me evidence, so I want to help you. And it was just that, I want to help you. I was on cloud 9, I left. It was pretty early. Of course, might have been to Parnassus fog, but it was like I felt like I had just gotten some affirmation from real mover and shaker from the federal government, formally from the federal government, and definitely validation and support from what Barbara Cooper said, a giant. I have giant in my notes spelled all over here. So she joined our National Research Advisory Council that I formed when I was at the Asian Pacific Islander American Health Forum. We were together for almost 3 years. We had several meetings, some here, some in Hawaii, lots of Dorothy Rice contact hours. And I devoured every bit of it to learn from her advice about strategy, about presentation of data. I devoured everything from her. She wore pearls all the time. I started wearing pearls all the time. She told me she was in the statistics section of American Public Health Association. I don't have any degrees in statistics. I joined a statistics association. I went to the meeting, and everybody else was like 30 years older than me. But I did everything she did. I mean, I went to her 70th birthday party, and Tom, you may not remember, but you were there and didn't meet you then. But I went to her 70th birthday party in her new house. The new house in Oakland, and I said, I'm so sorry, Dorothy. And she says, no, look at my lovely modern furniture that I just got. Leather, I think. So then I started liking modern furniture. And then she showed me pictures of Turkey that she had just gone to. And so my next trip, Turkey. Maybe she had an influence on me. So at some point, our 2.5 years together did come up with returns, because she's efficient. She doesn't want to do things just to do things. So we were able to get a bill. Norm Mineta's sponsored an Asian Pacific Islander Health Improvement Act. It didn't have money, didn't have appropriations. It later had appropriations with the Disadvantaged Minority Health Improvement Act. And there were resources that were brought to bear to the National Center for Health Statistics to improve data collection and reporting of Asian American Pacific Islander subgroups. So that was like in less than 2 years. So by that time, I said, I think I need to move on, and pearls, Turkey. I wanted to be a health economist, just like her. So she said, well, yeah, you should apply. And I said, well, can you do my letters? And she goes, well, you think? And I'm like, yeah, I think, yeah, you should do my letters. So she did my letters, and then I got in, and then I asked for her advice, because there were 2 schools I was considering. One was UCLA, and the other was another university in the East Bay. So she was very, very objective. And, she didn't tell me yet that Tom was at UCLA, but she was just very, very objective about the pros and cons. She goes, well, you have a great apartment in Twin Peaks already, so think about that. You have your family, you have your work, and so she was very, very objective. But when I chose UCLA, then she actually says, oh, great. So she was so happy. So she greatly influenced me to be a champion of what I call data equity. And in fact, we wrote a paper about 2 years ago on data equity, both from an advocacy perspective, when I was this advocate trying to get better data for a group I cared about, and then in my career from an accountability perspective, from a consumer of data to a producer of data, and certainly in my position right now, leading the California Health Interview Survey, which is a population-based data here in California. So Dorothy was my first love in my lifelong commitment to public health and public health data systems. And as with all first loves, I will never forget her.
Hi there, I'm Rachel. I'm married to Ken. And one of the most wonderful things about being married to Ken is that I get to call Dot my mother-in-law. What a wonderful life we're here to celebrate. What a wonderful being. She was, for sure, the clearest person I've ever known. And I've never had so much trouble finding the right words to capture someone's essence. Beginnings, endings, endings and beginnings, miracles. I met Dot during the beginning of Jim's ending. I got to know her within the context of Dot and Jim, although Jim's essence was really fading. Sometimes the ending of the life of your beloved, it becomes a turning point filled with layers and layers of pain, darkness, sadness, grief. That was there for Dot, I saw it. Yet it was also within and amidst his ending that I first began to really see her shining and to witness her light, her heart, her smart mind, her clarity, her gratitude, and her incredible acceptance of whatever was and is. And all that continued, and it continued to grow. My beginnings with Dot also happened during the last decades of her own life, endings. As she aged, and parts of her body naturally started to work a little less well and then a little bit more less well as it happens, that light remained. In some ways, as her body declined, it almost seemed like her light became even brighter. And I don't know if that was, next to the landscape of a body that was slowly but definitely declining. And in some ways it doesn't really matter. But even amidst that time, there were so many beginnings for her. New committees, new talks, new experiences, new friends, new everything. There were always beginnings for her and lots of light. Dot and I had many, many conversations about her own ending. Her wishes, shockingly, were very clear. Her goals ebbed and flowed. She mostly met them all. And in that process of meeting those goals, her wishes just crystallized. I've had a wonderful life, really. If my heart stops, that'd be a wonderful way to go. She approached her own ending with clarity and acceptance, filled with and infused with a quality that we might call grace, but it was way more than that. Early in the morning on Friday, February 24th, Dot had had a pretty rough night. Then it was actually her first rough night after breaking her hip and having surgery at age 94. And I spoke with her pretty late that night. So early on Friday morning, the phone rang, and I picked up the phone, and it was Dot. And she said, "Rachel, I'm incredible. It's incredible. I feel so much better. I can't believe it. I am really incredible." She died less than 24 hours later. Her ending was quiet, planned, totally congruent, as Morgan spoke to, with ease and grace, and in some ways not a surprise. It was so true and consistent with how she lived her life. What an incredible gift. Although I never wanted it to happen, I was very prepared for her to die. I felt so honored to be present in her process of ending and the end, and just so respectful. I will always feel so respectful of this incredible circle of the incredibly full life that she had. But now, this beginning of life without Dot, I can't say I'm ready for that. And here we are, together in this beginning to live without Dot's physical presence. When I think of Dot, which I do a lot, I think of light. I started to think about lighthouses, something that brings light when there's darkness, something that is there to bring light when there isn't light. And I don't think or believe that Dot even felt that her purpose here was to bring light. But at least in her last couple of decades when I knew her, that's exactly what she did. Over and over and over. Maybe even more so in the last week of her life. I have a feeling that, like a lighthouse, we may each feel that light shine in life's darker moments, or maybe it will just add more light to life's brightest moments. Remind us to celebrate, to shine, and magnify the light that may be always present in beginnings and certainly in endings, such as the ending of her own life. Beginnings, endings, miracles. Dot was a miracle, and that is abundantly clear.
So I'm Stan Glantz. I'm a professor here at UCSF, and I'm going to tell the same story I've told before. Tom emailed me and said, "Are you going to tell this story? Because if you don't, we will." But I said I'm going to. But I thought of two other stories too that aren't too long that I'm going to tell. So I joined the UCSF faculty in 1977. And then among other things, got involved in an initiative in 1978 to have the radical thing of having no smoking sections. Not smoke-free, it was like all the smokers had to sit over there. And one of the big issues that you get into when you're, in fact, Peter Hanauer, who is the guy who got me involved, is here. And one of the big issues in an initiative campaign is, what's it going to cost? And I did my PhD minor in economics, which made me, I knew enough to be dangerous. And so I got assigned by the campaign to do the cost-benefit analysis of this initiative, and I found this paper by Cooper and Rice, and I finally met Cooper, who's a lot shorter than I thought she would be, actually. But probably the same height as my wife, so it's okay. And you know, we worked up some estimate of how much money this, you know, restricting smoking and encouraging people to quit smoking would have. And then we did another one a couple years later, and then a couple of years later, and I can't remember the context, I was asked to do it again for some reason, and I kind of thought, you know, I've been kind of winging it here, and I sure wish I could talk to one of the people who wrote this famous paper. And I don't know how I found it out, but it was like Dorothy Rice was on the UC faculty. She had just recently joined, and I didn't know that. And so I picked up the phone and called her and said, could I come meet you? Now, you know, before you've met people, at least for me, when you're dealing with people who have done such groundbreaking, famous work, I mean, I'm not that tall, so I always predict that they're very tall, okay, and kind of look like Hercules, very tall, or I don't know what the female equivalent of Hercules would be. So I went over to her office in the nursing school, and I go in there, and here's this little tiny woman sitting in a little tiny office with paper stacked to the ceiling. You know, if there was an earthquake, she would have died because all the paper would have fallen on her. And just the nicest, you know, and I walk in there, I'm like an assistant professor who knows me, you know, and it's just like everyone else said. You know, she was gracious, she was interested, she was engaged, you know, she was helpful. And it was like, oh my God, this like very famous person is talking to me and being helpful. And I really think, and the thing Tom said, you know, said to me in raising the story is it really does encapsulate, I think, who Dorothy was, you know, just a tremendous intellect and just a giant intellect, and who's just, I mean, the one good thing about her passing is in reading her obits, she was even more famous than I knew. But it just was who she was. She didn't let it go to her head. She was always about moving things forward. And so the second thing I just wanted to mention was that, you know, coming out of these two initiative campaigns that we had run for the radical idea of having no smoking sections, we created an organization called Californians for Non-Smokers' Rights, which I then inherited the job of treasurer, which is the shittiest job to have in a struggling nonprofit doing, you know, radical things that weren't, you know, you got to think back. This was a long time ago. Now it's like you talk to students and say, you know, you used to be able to smoke in elevators, and people just think you're nuts. And so I ended up, the thing about being treasurer is everybody thinks you have more money than you do, right? You're the one person who has to have a sense of reality in an organization, because you can't spend money you don't have, unless, of course, you're a Republican administration. But you know, everybody thinks you have more money than you have, and you're the one who has to tell everybody no, and they get mad. And ultimately, I became the president, and I don't remember quite if it when I was president or later, but we recruited Dorothy to be the treasurer of what had then become Americans for Non-Smokers' Rights, who did it for how many years? Huh? 30 years. And you know what? And helped to shepherd much longer than I had a formal role, and really helped shepherd this organization into becoming a major force all over the country. And was always, and you know, for those of you who I can tell from the laughter have been involved in small struggling nonprofits, they can have lots of politics and crazy behavior, and she was always just a voice of sanity when everybody was just going nuts. And you know, I think the contribution that she made to not just developing important new ideas, but helping to take them into the real world and making change that actually affected real people. I think her role as treasurer of ANR was really an important manifestation of that behavior. And then the final little story I'd like to tell is I have been a member for longer than I want to, for like 33 years. I keep trying to resign from this and can't. And I'm a member, I'm an appointee by the California State Senate to something called the California Scientific Review Panel on Toxic Air Contaminants, which is part of the air pollution regulatory process. And I'm appointed by the Senate. It's a 3-year appointment. And they just keep reappointing me. And I got to know the appointment secretary for the state Senate, a woman named Nettie Sablehouse, who would call me up every 3 years and say, do you keep wanting to do this? And we kind of developed a relationship. And you heard that Dorothy was a member of the Tobacco Education Research and Oversight Committee, which oversees the California Tobacco Research Program, the education program. It's many, tens, hundreds of millions of dollars. It plays a really important role in shaping this program, which is tremendously innovative, and also protecting it politically from bad people. And I don't know if this was when Dorothy was being appointed by the state senator, or if she was appointed by the governor, because Nettie moved over to the governor's office at some point. But a few years ago, I remember getting a call from Nettie, and she said, because I'd actually been on the tobacco committee too some years earlier, and she called me up and she said, you know, there's this woman named Dorothy Rice who's been on this committee for several years. She's kind of getting on in years. And, you know, do you think she has the stamina and the sharpness it takes to continue to oversee these major controversial programs? And I said, yes. Thank you.
It's always a hard act to follow Stan. I'm Judith Justice, and I, as everyone else, am very honored and pleased to be asked to share memories of Dorothy with the people gathered today in celebration of her life. Although Dorothy and I were colleagues for many years, we worked in different academic spheres, which didn't directly overlap, and therefore, I didn't have the opportunity, as many of you here have today, to be a direct collaborator. However, this didn't discourage Dorothy from asking astute questions and offering always relevant suggestions about my work on global health policy in faraway countries such as Nepal and Malawi, always making me think about things I hadn't thought about myself. My friendship with Dorothy really deepened when commuting from the East Bay to UCSF, or back. Although for many years, she traveled from Oakland on public transportation, shuttle, BART, and bus, which to me was crazy, but further proof of the amazing Dorothy. And it was I really was pleased when she began accepting rides home. And since it was usually rush hour, we had more time to talk and for me to learn about her impressive path and members of her family who meant so much to her. And I've met many people here today, but many I haven't. So it's wonderful to see you, and I look forward to the reception, to talking, and to hear some of the things Dorothy has told me and others from your perspectives. And Dorothy talked so much about her nieces and nephews and grandchildren, and especially her youngest grandchild, Alana, who it was like another chance to be with a new generation, and that gave her great pleasure. Dorothy was always concerned that it would be an inconvenience for me to pick her up, but I assured her that arriving at any event with Dorothy enhanced my status. And I viewed it as a privilege, as others have talked about her early life and also the many memories of her brother and her sisters. And I was impressed not only by Dorothy's achievements, but also that many of our discussions about the role of women, and that she accomplished this at a time when it was much more challenging for women. In fact, am I right in remembering she told me her first job interview, she was asked if she could type, and she said no, and she didn't take the job. And of course, these accomplishments did not stop when she retired. And as many of you know, she retired several times. As I predicted when she told me about moving to Piedmont Gardens, I said, "You'll become president immediately," which she did, and then continued to serve on as many as 9 committees. I think she had retired from one just before she died. She was on all these committees at the same time, and as someone else mentioned, she was so committed to raising funds for the staff. And I saw her in action when we'd be at dinner, how she would work the room and get people to contribute. She was really shameless. Others have talked about Dorothy's work and her second career here at UCSF. But I remember during one commute home, she was especially animated, talking about assembling all of her papers and reports and articles, and was eager for me to come to the apartment to see the recently bound volumes and take a photo with her and the books as background. Ken told me that these volumes are now with Tom. That was something she... And the picture. I always looked forward to dinner with Dorothy, especially when Dorothy and Joyce Lashoff, as Carol mentioned, as a mutual friend, were together, discussing their early careers and shared histories in health in Washington, modestly mentioning their many contributions at the national and state levels, and also their analysis and insights about the current situation, putting things into perspective and being able to look at the bigger picture. The obituaries describe Dorothy's many accomplishments and contributions, but they did not talk about her mentoring, although others here today have. And this was really so special. And she gave much time to this, following and supporting the career of her younger colleagues right through. Although she talked about all of her colleagues at IHA, she especially appreciated Doug McCracken and his generous IT support. It was so important to her to keep using all of her devices and computer. And one last point that the obituaries did not mention, but Wendy did, was that Dorothy was always the best-dressed woman in any setting. And even when sitting in the car together, I felt that I should make a little more effort to try to come up to Dorothy's standard. My last visit with Dorothy was at the hospital after her fall and surgery, when she was not quite as well dressed as usual, but every bit as much in control, gathering information, making her own decisions, and charming the medical staff. I'll miss Dorothy, as others have said, in many ways, but especially our time in the car commuting. It was really, I just had her to myself, including our many years of driving together to Palo Alto for Wendy Max's annual New Year's celebration. And we analyzed her discussion with you on the way home this year. And I'll think of all our interesting exchanges, and that the time went too fast, as there was always more to discuss and learn from Dorothy. Thank you.
I'm Doug Novins. I am Rochelle's son and Dot's nephew. And I want to say more things just based on all the things that I've heard, and I'm just gonna pick one of them. The rest I'll save for the reception. I have my favorite Dorothy Rice recipe. It was my go-to recipe in college. It was apricot chicken. So you had your chicken, a can of Smucker's apricots, some Russian dressing, and a packet of Lipton onion soup mix. And that got me through college. So I'm going to talk about two things as I think about my Aunt Dot. The first is her influence on my own professional development. So when I was in the late 1970s, when Dot became director of the NCHS, my sister, my brother, my mom, and I went to visit her at the Park Lawn building outside of Rockville, that cavernous federal office building. And we all came away with very, very vivid memories of that. Kara actually used the visit for her college application. For me, it was being in a place where people were using science and thinking about how they could change health policy. And we left, she gave me a few books on vital statistics. I think they were the first books in my life that I opened that were filled with numbers. And I'd never seen anything like that before. And I think, Don, it was probably recessive on my side of the family, and it was latent in me until I was about 17 years old. After that, when I was in medical school, she would come to visit New York. I would get a chance, as I was learning to be a doctor and really focusing on my clinical skills, it was a chance to talk with someone who was looking at the whole healthcare system and helping me think about the world that I was entering in a much bigger way. Years after that, when I decided to pursue a career in research, we would talk about grant applications, papers, frustrating peer reviews. As a second-year assistant professor, she somehow got me an opportunity to present to an Institute of Medicine committee that was trying to figure out how to advance substance abuse research. It just helped me really broaden my career and my vision. I was in psychotherapy when I was a psychiatry resident, not uncommon for psychiatry residents at that time. And I had told my therapist that I decided to become a child and adolescent psychiatrist. And my therapist told me, wow, you found a way of blending your father's career as a psychiatrist and your mother's career as an elementary school teacher. 7 years later, when I decided to become a researcher and go into an academic career, I wasn't in therapy. But if I had been, I believe that my therapist would have said, wow, you also found a way to combine that career of your Aunt Dot. The second thing I'd like to share is bigger and more important, and it's the greater gift that my mom, my Uncle Joe, my Aunt Shirley, and Dot gave to me, my brother and sister, and all of my Pechman cousins. First are those Pechman values. My mom talked a little bit about that, and I think we've heard that from many of the speakers today. Integrity, the importance of education, hard work, being engaged in the world and trying to make the world a better place. All of our parents embodied those values in their professional lives. We've heard all about Dot. Joe worked on really important things around tax policy. Shirley kept inner city kids in school. My mom educated those kids. My brother and sister and all my cousins, we all had to live with that legacy and find a way to make it our own in all our own ways. We also had the PechNet. I think it predated the internet by probably 30 or 40 years, but it's this kind of quantum mechanics fuzzy thing where I can be in Colorado not talking to my cousin Ellen and maybe not in touch with her for a long time and knowing exactly what she's doing. Dot was a key node in the PechNet, and I think we're all adjusting to her absence and how to keep the PechNet going. There was the dress. The baby dress that went from pretty much every grandchild and other children, I believe, in the extended family that she made and that we passed along. And then even bigger is the web of support that connects all of us. When me and my brother and sister were teenagers, we'd go to DC with our best friends, stay at Dot and Shirley's house. We'd take the bus and then the metro into the mall, spend the day in the museums, come back. They would make us matzo ball soup, waffles, talk about all our adventures in the big city. When Howard moved to New York to go to medical school, he became a part of our family and the big brother that I had never had before. When Scott moved to the East Bay, Scott is my cousin on my father's side of the family. He became a part of the incredible Pechman Rice East Bay community. When Audrey and I moved to Denver 25 years ago, Don and Peg helped us find our feet. And now that Audrey, Lori and Woody's daughter, has moved to Denver, we're helping her find her way in the Rocky Mountains. And when you put this all together, what you're really talking about is love. And this is the love of brother and sisters who cared about each other and cared about their children. And that's what they passed on to all of us. And that is, I believe, Dot's greatest gift to all of us.
Hi, I'm Mitch LaPlante, and I'm a retired professor now from UCSF, but I am fortunate to be one of Dorothy's proteges, and I would hope that she would consider me in that way. Dorothy was a mentor extraordinaire, colleague, and friend for many years that I spent at UCSF, the Aging Health Policy Center and the Institute for Health and Aging. So I was a graduate student in my 20s at Stanford when we first met, not too long after she came here from Washington, sometime in 1982. And I was analyzing down there large national health surveys. Hal and I also met down there. And with lots of data that was stored on, big magnetic tapes. And for some of you young people who may not know what they are, they were about the size of the seat on the stool. And there were lots of them. So I had gotten a job here at UCSF as a research assistant, and everyone I met here said, Mitch, you have to meet Dorothy Rice. So we got introduced casually, as I recall, and Dorothy asked me in her gracious manner, with those wide open, probing eyes and a huge smile, just like the picture here. Mitch, what is it that you're researching? And I explained to her, and she said, this might sound a little strange these days, but she said something like, really? You can analyze the National Health Interview Survey? We have to talk. So she had been looking for someone who could help her with her data analysis that she was used to when she was director at NCHS, but she couldn't find anybody here. So she invited me to her office and proudly showed me her big bookcases filled with statistical reports, as Stan says, up to the ceiling, and also bookcases filled with dozens of these big data tapes. So I ignored the little lump I had in my throat, and I said, no problem, I can deal with that. And I guess I already had the statistics gene, so we hit it off right away. Of course, Dorothy was a big player. She gave keynotes left and right at important conferences in Washington and around the world, and I was giving her numbers to put in her presentations, update her work, and so forth. So I was flattered when she told me, the first time I produced something for her, Mitch, your numbers are exactly what's published in this report. There wasn't even any rounding error. Fantastic. But then she'd look down the table and she'd say, but this number's wrong. Why is that? And Dorothy had a particular knack for doing that, unlike virtually anyone I've ever met since. I guess it's a skill you either have or you acquire as a director of a statistical agency. But being my perfectionist self, I was a bit mortified. But I took it in stride and we sorted it out, and I eventually gained her confidence. So it could be interesting working with her as a former director of a federal statistical agency. Sometimes I had to prove it wasn't me that was wrong, it was the data that was wrong. And I'd tell her, and she sort of wouldn't believe it, but then I'd prove it, and then she'd call up NCHS and they'd release a revised data product. So after I got my doctorate, I spent the year in DC, and then I came back to San Francisco because I didn't really like it there. And Dorothy helped me land a fellowship in health policy and an adjunct faculty job. And that's how I started my career. So, as people have said, you know, Dorothy loved to pack her presentations with numbers, and I remember her saying to me once when we were talking, as only she could, "Mitch, people love numbers." But she was a researcher who firmly believed that data should drive health policy, and she did just that. She used her reliable, authoritative numbers on inequalities to influence people and drive policy forward. We certainly need more Dorothys in the times we live in now. So I was a sociologist and Dorothy was an economist, but it was our similar interests in public health that bonded us together. I was helping her work, with her work on lost productivity, and then I realized that that really overlapped a lot with disability, and I devoted my career to that subject. And Dorothy got interested as well, and we worked on a number of things after that in the area of disability. Once we had a rare disagreement about the meaning and use of the term work disability. I used it in the generic sense of people having difficulties working, not just a disability caused by working at a particular job, but Dorothy insisted that's what it should mean. So she got quite worked up about it, actually, and she wrote me a letter on the plane as she was coming back home from a conference, and she put it in my mailbox. I opened it up, and she explained why she was right, and then it concluded, "Mitch, you're wrong, you're wrong, you're wrong." Well, that kind of shook me up, but we talked it over and soon came to agree, or we agreed to disagree anyway, and we laughed it off. So the thing is, we enjoyed working together over decades, and there's a lot of things I could say that I'd like to, but maybe during the reception. But our work contributed to the advancement of public health and disability studies. Her orbit was far greater than mine, and I can't compare my achievements with hers. But in my own small way, I learned to use numbers, I think, the way she did, sort of through osmosis. She never really sat me down, and I don't remember discussing, how to effectively present information. I think I just sucked it up by her example. And so, but there was one thing that really superseded Dorothy's love for numbers, and that was her love for her colleagues and her family. And every time when we'd begin a work meeting, she'd ask me what's going on with me personally, and my partner, Steve Kay, now my husband, and we'd talk about what her husband, Jim, and her sons were doing up to. And I remember she was so thrilled when she became a grandmother as a result of Morgan, and she was practically walking on air throughout the Institute for days. So as I look back fondly on this gift I was given, I'll just say that I can't imagine where I'd be without her interest, her inexhaustible enthusiasm, her wisdom and her kindness. Bless you, Dorothy. You have a special place in my heart and my mind forever.
My name is Charlene Harrington, and I was a colleague of Dorothy here at UCSF. And I joined the faculty to work with Carol Estes and Bob Newcomer in 1980, which doesn't seem like very long ago. And so I knew Dorothy when she first came to UCSF, and I think it was visionary of Carol and Phil to make it all happen, because Dorothy really added an important dimension to the School of Nursing. She was, of course, the first economist, and then she brought in Wendy Max, and so it really had a great benefit to the school. And I just want to say that Dorothy was the person that I think we all wish that we could be. She was greatly admired. And you've heard about all her accomplishments today, but I think the thing that was very, very important is that she completely and passionately believed in health care and Social Security for all. It wasn't just that she was a great professional. She had a great belief and a passion to make this happen. So I think I was very fortunate to be able to work with her, not as closely as some of the others of you, but I felt like she was an ideal mentor to me. And on the personal side, I'd like to say that Dorothy always used to say, "I've had a wonderful life, and I've been so fortunate to have a great career and a supportive family." And so some of you might think that Dorothy never had any problems to deal with just because the way she always came across. But yet, she and Jim lost their house in Oakland, and later had her own health problems, and Jim had health problems. But she always managed to be very positive and think about looking into the future. So like after the fire, she immediately went out and bought new clothes, and we all greatly admired her clothes, many of you. I wore my purple in her honor today. When Jim was ill and he moved to Salem Lutheran, we had many discussions about the personal problems of dealing with dementia. And Dorothy recommended Salem for my husband, Ben, who had dementia. And she was very supportive over the many years that I was dealing with that. We got to know, there was kind of a group of us that at Salem that had our own personal experiences of dealing with dementia. And Dorothy would invite us over late in the afternoon to have wine and cheese at her place and hors d'oeuvres. She always had everything laid out beautifully at Piedmont Gardens. And then we would all go out to dinner, so we had many enjoyable evenings. And I just want to mention, as many of you have already said, the most important thing to her was her family. And so in these times that we would get together, she always talked about her grandchildren, her children, and we always looked at a lot of pictures that we enjoyed. And someone else mentioned that when she moved to Piedmont Gardens, she almost immediately became the president. And she quietly ran the whole place. It was amazing. And right as someone said, I think she was on 10 committees right before she died, and she was still publishing the newsletter. She was the leading promoter of Piedmont Gardens. And I think it was about 2 weeks before she died, I learned that she had had 10 people visiting that were prospective people that were going to move to Piedmont Gardens, and she always invited them to her apartment, which of course was the most beautiful one at Piedmont Gardens. And so she was a great salesman for them. And when my international colleagues in geriatrics came from Norway and other countries. She would always invite us over to meet with her, and she would take us on a tour and show us her apartment. And then she would spend a lot of time finding out about long-term care in other countries. So in geriatrics, one of the big things to study is successful aging. And I have to say that I think she was the most outstanding example of successful and graceful aging. She'll be missed.
Well, thanks to everybody who spoke here today. Really a wonderful composite of my mom and all her wonderful attributes and generosity and light and spirit and everything else. So thank you so much. So we've got about a 6-minute or so video coming up here, and I want to thank Jay Sullivan of UCSF for compiling it. The family and a few friends just shot him a whole lot of photos over the last 2 weeks or so. So you can see these photos. They aren't labeled. They're not exactly chronological, but we'll try to, after during the reception, we'll try to identify who is who if people have questions. And the last, say, 30, 40 seconds of the slideshow, and it's 90 slides or something like that. At my mom's 94th birthday last year, which we had in our house in Oakland, and she's on the deck and just talking, and I popped on the video camera, and we just got her talking about her life. So that's the last 30, 40 seconds of it, which I think in a half minute or so kind of reflects how she feels about her life and how wonderful it was.
had, we've had our sad moments, but mostly I remember the happy moments, and it really has been a happy life that I had. Sometimes I've said, I never knew I was poor until high school or something like that. But it hasn't mattered in my upbringing. I had a happy childhood, and it's been really wonderful. So thank you all for coming and helping celebrate 94. Oh my God.
Here.
So as Ken mentioned, my name is Rebecca. I'm a rabbi across the bay in Berkeley, and part of that incredible network of family that Doug talked about. It feels a little strange to me at the end of this incredibly packed program, which was so beautifully woven with family remembrances and also professional remembrances, which, just as a side note, I'm so grateful to you for sharing with me and some of us in the family who certainly knew she was an Eshet Chayil in the language of Proverbs, a woman of valor, a grand woman. But sort of the extent, maybe we didn't quite know. And what I'm here to do is something that she wanted me to do, but feels a little out of context. And so I just want to say, I guess, that I'm here representing what one of the residents of Piedmont Gardens described her as on Thursday at a memorial service that some of us were a part of, which was as a Yiddish mama, which was certainly an important part of who she was as well. So there are two traditional Jewish prayers of mourning that we'll recite in her honor this afternoon. The first you do not have the words to, I'll just chant that for you. And the second is on this photocopied white sheet of paper here. And you're welcome to read along with that one in the Aramaic. And both of these are traditionally done while standing, so if you are able, I'll ask you to please rise. El Malei Rachamim Shochen B'Maromim Hamitzeh Menucha Nechona Tachat Kanfei HaShechina Im Keroshim Otorim Kezahar Harakia Mazhirim Et Nishmat Devora Bat Lea Begershon Shehalcha Leolama Ba'al HaRachamim Yastireha V'Seter Knafav Leolamim Vitzror HaChaim Et Nishmata Adonai Hu Nachalata V'tanuach B'Shalom Al Mishkava V'nomar Amen. recite together. Yitgadal v'yitkadash Shemei Rabbah Ve'alma divrach Rutei v'yamlich malchutei B'chai echon uvyom echon Uv'chayei dechol Beit Yisrael Ba'agala u'vizman kariv v'imru Amen. Yehei Shmei Rabbah mevorach le'elam u'lalmei almaya Yitbarach v'yishtabach v'yitpa'ar v'yitromam v'yitnaseh V'yithadar v'yit'aleh v'yithalal Shemei dekudesha barichu Le'elam min kol birchata v'shirata Tushbechata v'nechemata Da'amiran be'alma v'imru Amen. Yehei Shlama Rabba min Shemaya V'chayim aleinu ve'al kol Yisrael v'imru Amen. Oseh shalom b'mromav Hu ya'aseh shalom aleinu ve'al kol Yisrael v'imru Amen. If you'd like, you can be seated once more, and we'll sing together now just that last line in Hebrew, Oseh shalom b'mromav Hu ya'aseh shalom aleinu ve'al kol Yisrael v'imru Amen. The translation, the last line, may all become one with the Spirit of the One, so that peace will reign on earth. And let us say, Amen. Oh, say shalom b'mromav, Hu ya'aseh shalom aleinu, ve'al kol Yisrael, ve'imru May Dorothy's memory be for us and for all we meet a blessing. Amen.
Well, thanks again for coming today. I think more importantly, thanks again for being part of my mom's life. Again, we have a reception out there hosted by Wendy and IHA. And Jay Sullivan will be doing some videotaping if people are interested in a couple minutes. Thanks.
I'm Claire Brindis, and I'm the director of the Institute for Health Policy Studies at UCSF, and I love Dorothy. So many parts of her I adored, and one of them that was so important to me was her lack of judgment. She was always so warm and accepting, and even though my field of research was totally different from her own, she was always very interested, wanted to know what I was doing, wanted to know about my family. And her lack of judgment was really so wonderful, such an incredible quality. Her acceptance was another gift. So I want to thank Dorothy for all that she gave to so many people, and her legacy will continue for many, many generations because of what she contributed and her generosity and gifts to all of us. Thank you, Dorothy.
So I knew Dorothy professionally. I had met her at meetings when she came to UCSF. I got to know her better. Then I really got to know her extremely well when she asked me to be on Institute of Medicine committee for which she was the chair. Little did we know that the committee would last 5 years. We would be in Washington 4 times a year for those 5 years, and then those 20 or so trips we would always be on the same plane. Sometimes she would stay on to see her family members, but usually we would be together both, and I got to know her well, and I got to know her values, and her values were the same care that she and love that she gave to her family members, she gave to all of her colleagues and her colleagues' families, and it was what she did professionally, making the world a better place for everyone so that they could share in the good fortune that she believed to be her own. She was the warmest, most competent person in the world, and I will always cherish my relationship with her particularly in those 5 years and those 20 trips to Washington together. But she lives on positively when we think about what government can do for people, and she lives on negatively in the current administration, which is everything that she was not.
My name is Michael Ong, and I had the honor of working with Dorothy Rice on the State of California Tobacco Education and Research Oversight Committee. Probably my fondest memory of working with Dorothy on that committee was when I spent time at her apartment in Piedmont Gardens working on the master plan for California's tobacco control. And I think what was best about that was not only were we working on trying to figure out how we would actually increase California's tobacco tax, but actually all the life mentoring that I got from Dorothy while I got the chance to sit with her in the apartment, got a tour of Piedmont Gardens, had a chance to chat over dinner, and really got a chance to hear about her life story and all of her life experiences. I think that what Dorothy really cared about the most was family. And what I really enjoyed sharing with her were pictures of my own young son, and I got a chance to also see her young granddaughter as well. So I really appreciate all the time I got a chance to spend with Dorothy. What an amazing woman and what an amazing mentor. Thanks so much.
My name's Danny Rice. I'm Dot's third grandchild, her youngest till Alana came along. Some memories of Dot. I think this was touched on really well in the ceremony, but you know, as her grandchild, she was just so present and so focused on us and so involved in our lives that I really didn't get to know about her successes professionally, and that came, you know, more and more as time went on, and really I kind of got to learn how special of a person she was through all these things. But she was just so humble that you know, I was able to kind of discover those things over time. So it was really kind of been a treat for me over the years to see what kind of a special person she was and how many lives she affected, and that was really great to see today how many people came and were really touched by her.
My name's Jonathan Phillips. I have a different perspective on Dorothy Rice, or Dot Rice, than most of the assembled. I'm not a professional colleague, and I'm not family, except I sort of am family. I grew up as Tom's best friend. From the time of 4 until I left for college at 17, I spent considerable time at the Rice's house. At times I thought I might not be noticed, until one day I realized, I was very much a noticed presence. This is a Dorothy story. I thought I was getting treats that were unavailable at my house, at the Rice's house, with no one noticing. They had cookie jars, something we didn't have in my house, and I would regularly go and take a cookie. So one day I was sneaking into the kitchen where I thought no one was noticing, as usual, and I took down a cookie jar and it was empty. And Tom came in at that moment and yelled, "Mom, we're out of John cookies." And I realized, people have noticed that I've been eating these chocolate-covered grams. So in my life, Mrs. Rice was a sort of a mother figure, a sort of a second mother often. She was, this also wasn't mentioned on her CV, but she was the parent leader of Pack 436, Cub Scout Pack. And she would lead us in exercises and learning about American civics and all sorts of basic singing the national anthem when we were 9. I think she only did it for 1 year when we were collectively average about 9 years old in age. Other stories include Tom's house actually was on a hillside, and at the bottom of the hill was actually sort of a triple hill. There was a creek, and my sister, Audrey, figured out on a snowy day that we could actually sled through Tom's yard and then jump the creek on our sleds. And Mrs. Rice came out and was horrified. Someone was about to break their neck on her property, and these lovely children, and I remember her rescuing us from ourselves. So those are the kind of recollections I have, and I hope other people enjoy sharing them with me. Thank you very much.
My name is Helene Lipton, and this is a message from me to my dear, dear Dorothy, whom I knew for so many decades. And I had the privilege and the pleasure of telling Dorothy directly what I thought about her personally and professionally on the occasion of her 90th birthday. But a few more memories came to mind at this wonderful, wonderful service today. I remember when Dorothy lost everything in the fire, and she was laughing as though nothing had happened. And I said, Dorothy, why are you laughing? She said, on many things. A, I'm still alive, and B, my 3 sons and their wives will have left to fight over when I'm gone. And that showed the remarkable spirit and wisdom of this amazing woman. I used to say to her, how do you manage to be so optimistic? The word kvetch is simply not in your vocabulary. And she laughed, and I said, Dorothy, tell me something. Are you sure you're really Jewish? Today, when I reflected more on your wonderful life, Dorothy, what I want to leave to you and your amazing family is that you truly embodied a life well lived. As a Jew, you give great credit and honor to our tradition. First, to love family, which is the backbone of how Jews have managed to survive. And then, through all that you've done for humankind, both here and around the world, the practice, beloved practice and sacred practice in our religion, tikkun olam, to take care of the world and to make it a better place. I was honored and privileged to know and love you. May you rest in peace. God bless.
So my name is Emmett Brady. I married Dot's granddaughter, Clara Rice, last year in September, which was a great event for Dot for the year leading up to our wedding. She constantly told us this was the one event in her life that was giving her the will to live, so there was a lot of pressure on us to put on a good event for her. And it turns out she actually ended up stealing the show at our wedding. They wheeled her up in her wheelchair, handed her the microphone, and she demanded that someone help her stand up because all the people were there to see her. And of course, she stole the show. She had people crying, people coming up to us after our wedding, telling us the best part of the wedding was Dot's speech, talking about raising Clara as a granddaughter and just how special that was throughout her life. But I knew Dot for many years before that, many, many years of dinners with her at Piedmont Gardens and many, many years of IT support in her apartment. I'm sure many of us can relate to that, helping her put the phone numbers into her phone, and then a week later she'll delete all the numbers somehow and get a call at 8 o'clock at night asking me to come over, put the phone numbers back into her phone. So Dot was always a very warm presence. Over the years, I moved from being Clara's friend to her boyfriend to her fiance to her husband, and she was always happy to introduce me to everyone in the room at Piedmont Gardens. So I'm going to miss Dot a lot. I'm going to miss mooching off of her for those free dinners at Piedmont Gardens, and I'm going to miss just her sarcastic sense of humor and just joking around with her all the time. We're going to miss you, Dot.
Dorothy was a friend and a mentor, and we had so much fun. We commuted also to and from UCSF with David in the car sometimes, and I put the tape recorder on often, and she told me about her life, her young life, and her early life, her work life, and I gave the tapes to Ken for her 94th birthday. And we had so much fun. We had lunch at Piedmont Gardens, several times lunch just a week or so before she died. And I spoke to her in the hospital, and I think her last day, and she said, damn, furious at she had fallen. And the next day, I got the email from Wendy. But she was such a wonderful person. I miss her so. What a lovely, lovely person. I want to hug her